Good evening. Hey everyone, this is Dr. Sullivan. I am here with another I Care for Your Brain free brain health evidence-based lecture coming to you on Wednesdays at 6 o'clock. I am a board certified neuropsychologist and I practice here in North Carolina. But I wanted to make sure more of you than I could possibly see in person one-on-one had access to this very important information that I share with you on this Facebook page. So we try to pick topics that are going to be educating and empowering to people with all sorts of brain health challenges, but also just people who are out there trying to do their very best in a very stressful world, which is why our topic tonight is chronic stress, why it happens, what is it we can do. It's something that is actually becoming more and more common, and what research is suggesting is that we're actually becoming more and more expectant of chronic stress. If you actually look at the discrepancy between how stressed people are and how stressed they think they should be, the two numbers are actually going up side by side. So what that tells us, I think, is it's kind of becoming normal. It's kind of becoming we're so used to being so stressed out that we don't even recognize anymore the difference between calm and peaceful and centered thinking and the treadmill of the stressful, chronically overwhelmed kind of mindset. So that's a big part of what we have to talk about. Why is that happening? Why are we all stressed out? So the first thing I wanted to do is just share some definitions with you of what chronic stress is, because it kind of helps us put it in perspective. So chronic stress is really the emotional pressure that we feel inside of ourselves after we have been kind of relentlessly experiencing something over a long period of time. And the key is that we feel like we have little or no control over the stressor. So this is generally an uncomfortable emotional experience, but there's very predictable biochemical, physiological, psychological, and behavioral changes that go along with being chronically stressed out. Another more simple way to think about it is just that there are things in our environment that demand something of us that we don't have the energy to give. Our wick is absolutely reduced. We don't have gas in the tank. We are kind of all done. But even when we get to that point, does life stop? No. Does the stresses of life stop? Absolutely not. We have people we're responsible for. We have jobs. We have to get ourselves our basic resources. There's a lot of things that demand things of us in our environment, and more those demands are becoming increasingly overwhelming and intense. So I want to ask you all, and I want you to write in for me, on a scale of 0 to 10, right now in this last 2-week period, how stressed out would you say that you personally are? So 0 is no stress at all. I'm a Buddhist monk. I feel totally in control of my inner and outer world. 10 is like, oh my gosh, maybe I should be going to a nice sanitarium somewhere and doing yoga and eating organic oatmeal for a week because I seriously need to chill out. If you look at something called the American Stress Survey, which the American Psychological Association does every year, our numbers, every single time we poll Americans, our stress numbers are actually going up more and more. So over 2016 to 2018, we've basically gone from about 25% of us saying that we're anywhere from 8 or more to 50% of Americans polled saying that they have high levels of chronic stress. Younger people typically report being more stressed out than older people, and stressed out about different things, which I'll tell you about in a minute. I think that's pretty interesting. Women tend to report being more stressed out. And of course, people with any kind of chronic medical condition are reporting being very stressed out. So one of the things you have to think about is, as we start to talk about this topic, is what are your personal stressors? Because remember, in this I Care for Your Brain lecture series, I always want you to make this information personal. That's how you're going to get the most out of it. So one of the clues that you can think about in your life about your own chronic stress is what are the things that you find yourself complaining about over and over? Because remember, one of the keys is that we don't feel a sense of control. If we felt control over it, we would make decisions that would actually keep the stressor low and it wouldn't become a chronic issue. So it's typically a relationship that we kind of go over and over again a lot. It's, some type of life circumstance where we just don't feel that we have the skills, the confidence, the assertiveness to do something about it. There's always a sense of helplessness. It can also be that there's a lot of kind of middle level stressors, and it's just the cumulative nature of these things, the totality of all of them, the way they all constantly kind of bleed us dry, that can wind up stressing us out. So remember before I said younger people tend to be more stressed. So millennials, which is 18 to 33, report the highest level of stress of all of the generations. Now, I think that's very interesting because in some ways you could argue that these are the people, the young people, that actually have had the least amount of stress in reality. So they haven't necessarily been alive long enough to experience significant international financial strain. They haven't lived through a Great Depression. Yes, there's been some military conflicts, but for many of them, it hasn't necessarily touched them in the same way that Vietnam did or World War II. Generation Xers is ages 34 to 47. That's my personal age group. And we're the next stressed out. The next one is the baby boomers. So that's 48 to 66. They're even less stressed out than the Gen Xers and the millennials. And finally, we have the matures, which is over the age of 67. So basically, self-reported stress level actually goes down as you get older. But we're actually stressed about different things. So if you ask millennials what they're stressed out about, consistently they say things like the state of the world, gun control, the environment. They are much more focused on kind of the outer, broader environment. Gen Xers talk about things like safety, security, being able to afford a house, if they're happy in their job. Boomers tend to focus a lot more on finances, being prepared for retirement, and matures tend to focus much more on health. So it totally depends on where you're at in life, totally depends on your physical health, and that all really goes back to Maslow's hierarchy of needs, which is one of the best, most relevant psychological concepts I've ever heard about, which is basically that your needs are hierarchical. And if you're at the bottom level of your needs, which is, basic shelter, having enough money to eat, you can't possibly care about things like self-actualization or, am I being mindful enough in my everyday life? Now, if you've got shelter and you have good relationships and you're financially secure and your health is generally good, that's when you're able to focus on things like making sure you make your yoga classes 5 days a week. There's nothing wrong with that. That's awesome if that's where you are, but that's not necessarily something that is realistic for someone when they're focusing on recovering from a traumatic brain injury, making sure they don't have another stroke. So it's very much personal and unique to the context of where we are. Stressors can be physiological, they can be psychological. So some of the physiological things are like dealing with diabetes. That is a chronic stressor in your body that has a certain amount of wear and tear on your physical system, your biological system, your social system, your psychological self. It's a very time-consuming thing to manage diabetes, just as one example. But of course, we have life events. People die, we get divorces, we are lonely, we struggle to, be in the world in a way that we're proud of. Basically, you get to decide what it is that stresses you out. But again, it's usually something that is kind of relentless, that is coming back time and time again, and makes you feel helpless, hopeless. It feels like you're trapped in the situation. Now, what we're going to talk about tonight when we get to, okay, well, that's a big problem, what do I do about it, is turns out it's really how we think about the things that stress us out. We have to really be realistic, not come to them with what we call cognitive distortions, which is where we basically have information processing filters, lenses that make it genuinely feel more intense and overwhelming than it really is. So what happens in the brain when we are stressed? Well, we actually have a very smart, sophisticated stress system in the brain, and this is your fight or flight response, and it is beautiful. It works like magic. When stress is occasional, when stress is intermittent, the problem becomes when it's the over and over and over again, and the system never really gets a chance to reset. So basically, the first thing that happens in this process of the fight or flight response is that part of our brain called the amygdala, this is our threat detector in the deep part of our brain, perceives that there is something in the environment that is a threat to us. This can be a letter from the IRS on the kitchen table. This can be someone walking down the street that makes you feel uncomfortable. This can be a chest pain. This can be your friend picking to hang out with someone else over you. There's all sorts of things that can be perceived as a threat. If your brain says, yes, this is a threat you should pay attention to, the stress response begins, and it is a very strong, powerful chemical reaction where we dump all sorts of neurotransmitters into our brain and all sorts of stress hormones, primarily from the adrenal glands, which are two little kidney bean shaped things that sit on top of our kidneys. And basically we get a big old dump of adrenaline and cortisol. These are the big stress hormones. Now in the moment, they're awesome. They do a great job. Our blood sugar shoots up. Our blood pressure goes high. It's bringing together all of these biological mechanisms to basically help us fight or flight, right? If we're going to run, our skeletal muscles need to be as oxygenated and have as much power behind them so we can haul butt and get out of here. However, if we're going to fight, we need to be able to have our wits about us. We have to be able to be wide open and concentrate and hyper focus on what's happening so we make the best decisions about how to defend ourselves. So the main hormone that we're talking about here is cortisol. This is a steroid in essence, and it's part of the glucocorticoid family. Most cells in our body have receptors for these stress hormones. And like I said before, once a threat actually passes, the whole idea is that this system is built to peak when it needs to. And then over about a 24-hour period, your body is able to break down, get all of these steroids out of the system. But how many of us feel occasionally stressed? Is stress, high levels of stress, something that you feel like you encounter every day? I would say absolutely for me. There's certainly times where I have a couple good days in a row where I don't feel stressed, but even with knowing all this information, it's just a very human thing, I think, in this day and age, to feel overwhelmed, to feel like we don't have enough of us to go around. And again, depends on where you're at in life. So one of the questions we have to think about is, well, what happens if this stress system never gets a chance to relax, when our central nervous system is just constantly pinging, looking for threats and responding to threats? Well, there's chronic implications. Chronic stress equals chronic health problems, chronic emotional struggles. The first thing we think of is actually things like increased risk for diabetes, hypertension, osteoporosis, and part of it is because those stress hormones have a very gnawing, negative effect on biological systems. We're really not meant to be excreting and absorbing that high level of steroids all the time. Things like weight gain, one of the things that the cortisol does is it makes us go into energy saving mode. And so we wind up storing a lot of things as fat that we wouldn't necessarily otherwise, because we feel like if a threat's coming, if my resources may be taken away from me, then boy, I better put a lot in storage to be able to call on it in the future when I'm going to need, energy. Fatigue, tiredness, exhaustion. How many of you know that one of the ways you realize you're chronically stressed is because you're totally and absolutely exhausted? That is always one of my big telltale signs. And so when we are exhausted, it's kind of the problem that becomes kind of like the negative snowball. So when we're exhausted, a lot of times it's that we're mentally exhausted. So we go to try to get sleep and we're not necessarily that physically tired, right? And so, of course, the mental and the physical are interdependent, but we also can sometimes be very physically awake, but also emotionally tired. We can also be dead tired in our body, but our brain is going, going, going. So all too often we're exhausted mentally, overthinking, trying to solve issues, not feeling like we're getting anywhere. And then we can't sleep because we're actually kind of wired. So it becomes kind of this terrible vicious cycle of you're not really even getting restored or rejuvenated at night because, you know, your body and your brain are just kind of out of sync. Cortisol also interferes with things like being able to make new memories, feeling like you can concentrate. Oftentimes, this is what leads to people feeling that brain fog kind of sensation. We also know dealing with a chronic stressor impedes our nervous system's ability to regulate its immune system. So we have two immune systems. The body has one, and we know as of a few years ago, the brain actually has one. So if your brain is so busy trying to get cortisol out of it because it knows it shouldn't be there, it kind of turns its back on other things that it also should be clearing out, things that shouldn't be there. So it's really a dangerous situation for all aspects of our health. We also know, of course, what happens when we're stressed. We have muscle tension, right? We feel sore. Some people are very sensitive in their stomach and they have all sorts of stomach upset if they feel stressed about something, chronic headaches, all this kind of tense, being unable to release and relax physical stuff goes along with chronic stress. Mental health wise, oh my gosh, anxiety and stress basically go hand in hand, and we think it's because of that helpless, hopeless feeling. That is a feeling too of restlessness, not feeling grounded, not feeling centered, not feeling peaceful. And that makes it hard to focus. It makes it hard to have a plan, to be able to actually have an idea and follow through the steps to fruition. And when we don't feel like we are being productive or living up to our potential, that is the groundwork for depression for many of us. And we get irritable and angry when we don't feel like we're getting to do what we want to do, right? We're putting out energy all day long to put out fires for other people. Why aren't other people doing what they're supposed to be doing? So it can set the stage for negative thinking, stressed out relationships, and then of course to cope, which is basically our way of managing these things. It's your way of getting out of the bed, putting one foot in front of the other, is we do things to try to change our emotional internal environment. So we do things like we turn to alcohol, or we overeat, or we withdraw from people because we're already too overwhelmed. So these things are something we're paying a very big price for. So what can I recommend? What does science recommend that tells you maybe a different way to go about it? Well, one of the big things you can do is to really slow down the stress response system. Remember when I told you a few minutes ago, the first thing that happens is our amygdala in our brain perceives that there is a threat. When you're not well informed about these kind of things, this is a very automatic, unconscious kind of a process. But what I want to teach you to do is to slow it down to the point where you can actually have a very small pause in between an event happening to you and your stress response. So that is the moment of appraisal. And what appraisal means is basically, is this a threat or not? Is this something that is a challenge? Is this something that I have the resources to handle or not? So literally in that split second when a stressful thing happens, if we decide it's a challenge, that just feels just think about the way that feels in your body. Oh, this is a challenge that's happening. It kind of implies that you can grow from it, that there's potential there, and that you can handle it. If we decide that it's a threat, then we immediately have to think about, well, how much of a threat is it? And the big question we seem to ask ourselves is, do we have the resources to handle it? So just as one example, you get that notice from the IRS and they tell you you have back taxes, $5,000. If you have $5,000 in the bank to spare, yeah, it stinks, it's stressful, but you immediately know, well, I have the money, I'm gonna be okay. Not how I'd like to spend that money, I was planning on going on vacation, but okay, I have the money. Well, what if you get that notice and you literally haven't bought groceries for 2 days and you're not sure how you're gonna pay the rent? That experience of getting that notice is going to be a lot more stressful. And there's some things that you're not gonna be able to put a positive spin on it. Something traumatic that happens to your loved ones in your body, to your belongings. Like, these things are bona fide stressors, but all too often we have stressors that we're just not aware of how we're actually interpreting them and taking them into our psyche, our brain, or cognition. So you really have to start to evaluate threats. How truly dangerous is this? How prepared am I to handle it? What are my resources? Who would I go to? So that's a big thing with handling stress, is if you have just one person that you feel like you can go to for support, whether that's words, whether that is someone to help you financially, it turns out that makes a big difference in how we all respond to stress. Just having that one person. You don't need a handful of people. You don't need a village in this sense. You really just need one person that you feel like you can go to. And I all hope you at least have that one person. So if you look at the research literature on managing chronic stress, I want to talk to you about 5 recommendations. So the first one is to really evaluate your coping and to add more positive coping skills to your toolbox. So like I said before, we're all coping, right? Or else we wouldn't be here. But we can actually cope in positive or adaptive ways. And we also can cope in negative, maladaptive ways. So the problem is that the negative maladaptive ways are actually very appealing and very enticing because it allows us to postpone the stress of having to actually deal head on with the issue. So things that are negative in terms of coping are things that help us avoid. So we are allowed in the moment to have a little bit of a decrease in stress because we put it out of our mind. We're going to kind of lock up those feelings over here. We're going to numb it out with drinking. We're going to numb it out with sleeping. We're going to play video games. I'm just going to get mad behind the person's back. In the moment, you might feel a little bit better, but that actually increases your stress level over time. Things that are more positive to do in terms of coping involve approaching the problem. And this actually might be slightly more stressful in the moment, but over time, this is actually how you get a handle on chronic stress. So the first one is not making assumptions. So many of us get into trouble by assuming, filling in the gaps, thinking we know someone's intention. It's very important to not make assumptions, go directly to the person and just clarify. That is the first step in interpersonal conflict. I want to make sure I understand why you said this. What were you thinking? Do I understand your perspective? Don't just feel like you're a psychic, a mind reader, and you know exactly what was happening. Not responding in the moment, being able to suppress some of that impulsive desire to want to get our point across or kind of, throw something back at the person. Actually being able to restrain and then plan our response has been shown to really, really reduce stress, because then we don't make it worse, right? Because in the moment, if you get a little bit snippy back with the person, typically you then now have guilt and shame to deal with on top of the thing that you were stressed out about. One of the biggest things that can help you interpersonally deal with stress is to become better about assertive communication. And that's something I'm actually going to do a whole nother lecture on in the next few weeks. But basically, it's sharing the respect in an interaction between not totally respecting yourself and having no sense of the other person's perspective, which winds up making us a little aggressive. And it's kind of like our way or the highway, and we're very assertive and clear about our feelings, our opinions, advocating for what we want. Or we can often go in the other direction, which is where we can become very passive and basically deny that there's a problem, don't ever have any response, but really deep down we're actually really upset and feel like our boundaries were violated. So many of us resort to passive aggressive communication when we go passive for too long, because it's just not normal, it's not human to be able to take it over and over and over again. People have a breaking point. So it kind of slips out of us, it kind of ekes out. And so this is where we use sarcasm. We may say things under our breath. We might have facial expressions that don't necessarily match exactly how it is that we're really feeling. We might kind of appear like we're going along with the program. We think, it looks like we're basically being cooperative, but we're giving plenty of indications with our nonverbal communication that we're actually really annoyed and irritated. So this isn't healthy for relationships. It's not helpful for us. We wind up remaining stuck in a cycle of powerlessness. calmness. And so it's really important. One of the most necessary emotional tools to develop as an adult is to learn how to be assertive. And it's not easy. I struggle with it all the time. So we'll talk about that in a future lecture. But number 2, evidence-based recommendation for managing chronic stress is to respect your need for sleep. How often we sleep, the amount of time that we sleep, the quality of our sleep, these things really influence the release of cortisol and our ability to basically mop it up after stress. Over time, sleep deprivation causes all sorts of havoc in our hormonal system. Even just one night of insomnia can cause your cortisol to be high for 24 hours. That's pretty significant. So you got to really try to get yourself on a schedule. One of the things that can mess up your cortisol is if you go to sleep and wake up at really different times. An hour difference here or there doesn't really seem to make a big impact. But if on the weekends you go to bed at 2 a.m., but during the week you try to be in bed at 10, that's actually a lot of stress on your system. Number 3 is one we all know very well, but probably don't do enough of, which is exercise. But you need to know the timing of your exercise as it relates to cortisol. So right after you exercise, you actually get an increase in cortisol, the stress hormones. This is part of the high. This is the feeling of, that little bit of euphoria, maybe more than a little bit for some of us, after we exercise. But after about an hour and a half, we actually get a decrease in cortisol. So you just don't want to do something very physically demanding within an hour and a half or so before bed. Number 4 is really learning the art of chilling out, relaxing. Part of the problem with chronic stress is that our central nervous system is just constantly running at this high level. Our work demands things, right? Our kids demands things. Our friends need our time and attention. It is a lot, especially then if you add on something like being a caregiver. And Armani, I'm definitely looking at you. When you are so consumed with loving someone into recovery, it just takes every ounce of energy that you have, and there's no time where your brain or your spirit just feels like you can just be and you can receive. You don't have to just keep putting out. So making sure that you prioritize relaxing, and this is different things for different people. Some people, it's music. For some people, they need to do deep breathing. For some people, it's going out and getting immersed into a movie. It really is very personal, but when you're not overthinking, when you don't feel exhausted, you have to try to prioritize those life experiences just like you would any other type of life experience. So the last one I want to leave you with, number 5, is actually music, just in and of itself, all on its own. So I've been thinking a lot about music therapy as it relates to folks with brain issues, especially dementia. And so I've been looking at that research a lot, and oh my gosh, it's unbelievable the power of music. So it helps to organize and identify our emotions. It helps us to get the emotions out. It actually, harmonies and melodies are very organized when we know the song lyrics. It's really just a sense of comfort because we can anticipate, especially when it's a well-known song, we know what's going to happen next. And there's actually something very comforting about that to us as people and us as people with a nervous system. So like I keep saying, part of stress is that it's unpredictable and you just you're constantly putting out, but you don't have enough. Music is different. You're actually taking it in, you're receiving it, and it's safe because for the most part we like to listen to songs we already know and we can predict and feel like there's a flow and calmness that comes along with listening to familiar music. It also brings back a lot of happy memories. A lot of the music I find myself listening to when I'm stressed out is music that I liked when I was a teenager, and it just makes I know all those lyrics and those instruments backward and forward, and it just reminds me of a time that was just a little bit less hectic and overwhelming. So I want to know from you all, what are you doing to try to cope with stress? Maybe after this talk you realize that you're doing some things that ultimately might be shooting yourself in the foot. I want to hear those too. Sometimes it's just a matter of getting back on track with positive coping. It's like so many psychological things in life is we often know, similar to exercise, what we should be doing, but we just need these reminders to get back on track, prioritize, good eating, sleeping, exercise, positive thinking. So hopefully this talk tonight can serve as a loving, healthy reminder to many of you that you really are doing so much, and it's so important to make sure that you have times in your life where you're just not doing so much, and you are remembering that concept of being a human being, right? Taking it in, just allowing yourself to be. So I'm going to be back on October 2nd, 2 weeks from now, and I want to talk to you about the importance of heart health as it relates to brain health. If you thought that this was interesting or helpful, I would really appreciate if you would share it on any of your Facebook pages. That is something that is so important to me, to just feel like this information is getting to as many people possibly need it. So I hope you all have a great week, and I will see you soon. Bye-bye.